Good morning, everyone. My name is Sarah Hance, and I'm the web events producer for MECC. Today's presenter is Brian Foss. Brian is the president of Foss Consulting, LLC, based out of the Charlotte, North Carolina area. Foss Consulting specializes in public safety, healthcare fitness, injury prevention, wellness, human performance enhancement, and fitness testing. Brian holds a bachelor's in sports medicine, is nationally certified and licensed as an athletic trainer, a certified strength and conditioning specialist through the National Strength and Conditioning Association, a paramedic, and has numerous certifications in manual therapeutics and soft tissue techniques. He's recognized as an expert in corrective exercise and functional movement analysis and training with a specialty in spine stabilization. Brian is the author of The Fit Responder, Fitness and Wellness Techniques for the Public Safety Professional, and has co-authored 3 other books on health and fitness.
What we are here to stop is essentially putting an end to overexertion-based injury. So, for those of us that aren't exactly familiar with the term overexertion injury, it is essentially where the tissue in the body fails. And it fails for a number of different reasons. Number one, it's going to fail from fatigue or posture, bad mechanics. There's tons of different reasons why the tissue can and will fail. A lot of the information that's out there is showing that the pre-claim average of a typical overexertion soft tissue trauma is roughly $5,000. But the average cost of an injury caused by your overexertion injury is pushing upwards of 10. So your normal injury, if there is such a thing as a normal injury, you're going to be looking around a $5,000 bill. For the overexertion injury, you're looking at close to 10. And these are the injuries that don't usually show up with imaging or x-rays or scans. They take longer to heal. There's greater inflammation in the area that is injured, and therefore the overall costs, time out of work, overtime paid to other employees, being short employees, or having to double up on shifts, has that cascade effect that makes that $10,000 fee for the injury even more expensive. So, talking about why overexertion injury occurs, well, it's going to occur from a number of different things. Number one is fatigue. And there's 2 different types of fatigue we want to take into account here. Number one is going to be the fatigue that you and I all know so well, which is that, oh, geez, I'm tired and I have to go to work. That will cause the employee to make mistakes. But we're also talking about mechanical fatigue and muscular fatigue. Repetitive motions will cause fatigue in the body, where the muscles essentially weaken, they get tired, they are unable to do their job due to lack of mechanical and or muscular endurance, and tissue failure will occur. Weakness has a big role in that as well. And there's a difference between weakness in the muscle and poor muscle endurance. Poor muscle endurance is going to be both from a movement standpoint and from a postural standpoint. We'll talk about the postural standpoint here in a few minutes. Weakness is essentially a muscle imbalance where one muscle is not strong enough to do its job, or it is influenced by an opposing muscle group causing weakness in a prime mover, or in a lot of cases with overexertion injury, a stabilization muscle or a synergist. Muscles that assist movements and or keep the body in a set plane of movement. Nutrition is huge. Now, I can teach an entire class for a full day on nutrition and injury. Take-home message here on nutrition, and this goes into wellness and health as well, is employees eating high-fat foods, eating foods that are full of sugars, will all have issues. Leads down the road with dehydration as well, all essentially changing how the tissue moves. Muscles don't contract very well, and they don't do their job very well when they are dehydrated and poorly fueled. The job task is going to take into account as well why overexertion injury occurs, and it depends on the job, obviously. If you have a sedentary seated job, your injury mechanics are going to be very different than a job that is very exertional, such as a municipal employee or even a healthcare worker who's having to transfer patients. And bottom line, along a lot of this stuff is just poor, faulty mechanics. Is the employees being lazy, being in a rush, not caring what they're doing, not paying attention to what they're doing, and just doing it wrong. Now, on the flip side of all that, of why things occur, could some of this be just how we're built as human beings? Maybe our machine, the machine that our body isn't quite up to the task that we need it to be. If you think back to prehistoric times when the cave people, to be politically correct, were walking around with a somewhat hunched and forward posture, the question that's been asked by a lot of experts in the field is that did cavemen really have back pain? Or was the fact that they were already into a somewhat flexed posture cause them to not have back pain? The take-home answer on that one, I would say, is going to be very simply that, they weren't stuck in faulty postures and doing repetitive motions like we do. So moving forward, what we want to think about real quick are some of the hows and whys of why this happens. If you look to the right of your screen, there's a red line down the anatomical model of the body. That is normal, efficient posture. That's what we should always strive to be in. As we get through the presentation here a little bit, I'm going to bring into one of the techniques what I call neutral spine, and you're looking at it right here. This is neutral spine. We should have normal curves. There should be a slight concave curve at the lower back and a slight concave curve at the cervical spine. There should be a convex curve at the thoracic spine and a slight convex curve over the sacrum. That is normal, efficient posture. The curves are supposed to be there. Those curves allow the lumbar spine to absorb shock and impact. It's when we lose that curve that we start to have problems. So the first postural pattern I want to go into, and this is going back into what I talked about briefly a minute ago of, do we get hurt possibly because of the way we are built? Well, if we are stuck in a forward posture for long periods of time, whether it be sitting, standing, working, typing, driving, reading, whatever it might be, we can have this very predictable cascade effect that occurs in the upper body, and it's called an upper cross pattern. This is very much a cause and effect type of relationship because we sit and lean forward too much. The muscles in the front of the body, the pec majors, they're the pecs, the shoulder internal rotators, and the deep neck flexors, the muscles that bring your head forward, become very tight and very weak. They concurrently take the muscles in the back of the body and start to pull them forward. Well, your body's natural response when it's being pulled out of position is to kind of tighten things up. So we feel pain, dysfunction, discomfort, and eventually injury in the back of the body, or the posterior half, where most of the cause is from the front of the body. Many of the programs that are out there that teach safe lifting techniques never take this cause and effect relationship into play. Concurrent with that posture is long-term seated postural distortion. So if you look to the picture on the right, in our seated anatomical neutral, which is going to be our safest posture to sit in, and then the picture to the left, which is going to be our long-term head-forward faulty posture, you're going to see that chronic strain that is put on the body, both on the ligamentous, the muscular, and the nervous system. And that's why a lot of these, specifically shoulder, neck, and upper back and elbow injuries occur, is because of this alteration in how the muscles move in the upper body. Now the big pattern, the granddaddy pattern that costs us the most money, is a lower crossed pattern. This lower crossed pattern has some pretty significant implications. What happens is this. Because we sit too long, we've played sports, we do the wrong exercises, essentially modern life, the hip flexor becomes very tight. So we're looking at the front of the slide right now. When those hip flexors become tight, they literally take the pelvis and pull it forward. So if we go back, I'll explain this here in a minute. So as they pull the pelvis forward, it actually inhibits the abdominal wall. Thus, the abs become weaker. Well, we all know intuitively strong abs, strong back. Well, guess what? The abs can't do their job. So the abs are weak, the hip flexors are yanking the pelvis forward, and the lumbar spine becomes overloaded. We lose the curve in most cases, or concurrent to that, the curve will become excessive. It just depends on the person. So we have an overloaded lumbar spine. Now, all this is going on, there's two important things happening. Number one, your hamstrings are locking down. They're trying to pull the pelvis back into place. That's their job. Their job is to reach the leg behind you and to reach the hip behind you and bend the knee. So when they feel the hip flexor pulling forward, they actually get tight, trying to pull your center of gravity backwards. Anybody that's sustained an injury before and has gone to the PT or the doctor, a lot of times they've been told to stretch the hamstrings. And guess what? It doesn't matter. The hamstrings can't physically let go. It's their job to stay tight. They're trying to protect you. Now, while all this is going on, you look at that nice little yellow box to the left of the screen, there's this great little term that has been coined called gluteal amnesia. So you have this tug-of-war going on between the front of the body, the back of the body, with the spine taking the brunt of the load. And while all this is going on, your glutes have essentially forgotten or become very, very inefficient at doing their job. So you're right, you're reading it appropriately. Your ass has forgotten what to do. And it really, really leads into what's going on with our lifting injuries. So with gluteal amnesia, and the glutes, by the way, one of their main jobs is to externally or rotate the femurs and or turn the femur out. So if you look at the picture on the right, somebody suffering from gluteal amnesia in a lower cross pattern is going to have altered patellofemoral mechanics or altered knee mechanics. Well, now you're going to have issues stepping up, stepping down, squatting, bending, stooping, or lifting. It's not from the knees where mostly the symptoms are going to be. It's usually coming from further up the body. The picture on the left shows a Q angle, which is very important in women, as women have a wider pelvis. Throw in a wide Q angle with gluteal amnesia, and you've got a pretty significant mechanism of injury around the knee, the hip, and the lower back. All of this being modifiable. So to kind of wrap up the upper cross syndrome versus the lower cross syndrome, our ideal posture, on the far left, letter A, that's where we want to be. Now, nobody lives in that posture. We have a lordosis kyphosis, which is sort of a lower cross, upper cross together, showing the excessive load on the body, which is B. C is one of the worst, which is a complete loss of curves. There's no shock distribution. These are the people that have essentially lost their butts. And the same thing with the sway back posture, which is D. All of this, again, depicted on the far right side is an excessive overload of the low back, hips, knees, and pelvis, causing angular changes and excessive compression in the lower back. All right, so enough doom and gloom. We have all these issues. We can't make them go away necessarily. We can modify them. But the question becomes, what are the 5 keys that we can do to prevent injury in these folks that have these postural distortions? Now, obviously, in the perfect world, we would love these folks to go work out every day, be in a very targeted and regimented nutrition program, stretch before their shift, but that's the perfect world. One of the things that I like to do, and one of the things that the data supports, is actually tricking the body to doing its job properly. So what we're going to teach is a training approach which a trainer, a supervisor, a manager, a safety officer, whoever has been trained in this technique can teach the employee to do their job more safely. And it's all based using the body as the tool that it needs to be. And it's like all goes back to the upper cross pattern and lower cross pattern. We want the body to fire properly. And if it's stuck in these faulty patterns, then it can't do what we want it to do, and hence then people don't lift properly. Now, we can all look at these pictures and cringe. The guy in the top right, oh man, that's some nasty lifting posture right there. That's just lazy, faulty mechanics. All the load is on the upper back and the lower back. You look at a professional firefighter who's doing a patient drag. Faulty posture. He's bent over completely at the spine. And you look at some iron workers on the top left. Same thing. Lazy, faulty posture. All of their movement is occurring from the lower back. The gentleman in the middle of that picture in the white, he at least has his knees bent and looks like he's trying to keep his back flat. The other two guys are just in horrific posture. All of that load is on the lumbar spine. Stand these guys up, and I'll bet dollars for donuts that they would live, these folks live in a lower cross pattern. Now, we can step back and take a look at all of our very complicated biomechanical and kinesiological data and say that, okay, the further you hold an object away from the body, the greater the compressive load you're going to have on L5S1 in the lower back, creating upwards of 2,000 pounds of force on that region. And if you keep the load close, it's going to cut that load down to less than 500 pounds, therefore reducing lower back injury. My question to all of you is this. That's all fine and dandy, but what happens when it's an awkward object? What happens when they can't lift with perfect posture because of their job? What if you're working in a hospital or nursing home and you have to move a patient to begin resuscitative effort? What if you're a public safety employee and you have no choice but to move quickly? What if you just don't have the flexibility or the strength to do the techniques that you were taught to do properly? And that's really one of the biggest things I want to go after today. So the 5 techniques that we're going to talk about to decrease overexertion injury are going to be looking at spine stiffness, core activation, lumbopelvic stabilization, i.e. stabilizing the hips and the lower back, and increasing balance. So as I've been alluding to, we want to trick the body to do what we want it to on an unconscious level, and that, folks, is behavior modification 101. Behavior modification, in a lot of cases, especially when it comes to lifting awkward objects, needs to be very much unconscious. So these employees need to be taught or retrained in a very, very specific fashion. So number 1 is a very weird technique when it's first taught. This is an exercise depiction of how to do the movement, and this is one of the things that we use in the clinical setting to basically turn the glutes back on or get rid of the gluteal amnesia. What we're looking for here is what we call rooting the floor. Now that sounds weird. Imagine that you were a tree, and your feet are the trunks of the tree. A tree can sway in the wind at the top, but the root of the tree never moves. When you are lifting, pushing, pulling, carrying, or doing anything that involves the feet in contact with the ground, which is most of our jobs, to simply have the feet set and rooted to the floor actually turns the gluteal muscles back on. So it takes those amnesic glutes and makes them fire properly. Anybody that listened to the webinar I did last year will remember that I make you do stuff during the webinar, which is very difficult because I can't see if you're doing it right or wrong. However, at this point, if you wanted to stand up, put your feet just about shoulder width apart, visualize gluing the entire foot to the floor. So we're talking from your big toe to your little toe to your heel is absolutely stable. And to sink your hips down and back into a squat and go up and down a couple of times, keeping the feet perfectly still. If the feet are rooted and you're hinging your hips, your glutes are turning on, thereby giving the spine a stable attachment point. So trick number 1 is to root the floor. Concurrent with that, as I just mentioned, with a slight squat or a hip hinge is technique number 2. Again, these are sort of controlled environment examples because they're easier to see. Instead of leaning forward at the spine, look at the picture on the left. If the feet are rooted and the spine is in neutral, and that's what the stick on the back is depicting, the hips are in a slight posterior alignment. If you look to the picture on the right, in neutral spine with the feet rooted. So if you look at the model's legs, which is me, by the way, the knees are not turning in, the feet are perfectly flat, nothing is rolling, nothing has broken out of neutral. I can move in any direction or plane that I want to, and I can go down as far as I want, keeping all of the load off of my spine and keeping the load on my hips, and glutes, and abdominal wall where I want them. So to combine rooting the floor and hinging the hip together actually takes care of about 90% of the lifting faults that we have. The third thing is shoulder retraction, or keeping the shoulders back, by taking the shoulder blades and pulling them down and back. So essentially, if you hold your arms out in front of you and you pull your shoulder blades together and slightly down, if you do it right, you'll actually feel your abs engage. That's because that movement actually forces your core to contract, thereby stiffening the spine. So when an employee grabs a load of any kind, whether it be a stable load, an unstable load, something that's easy to hold or something that's not, simply rooting the floor, hinging the hips, and we're slightly retracting the shoulder blades into the body. So the load is now taken onto the torso and not the arms. Actually forces the core to naturally engage, and that is one of the biggest techniques we teach. If we can get the glutes turned on, if we can get the core to turn on when the employee is not conscious about it, we've done an amazing thing, because now we're going to be looking at well above a 42 to 48% reduction in overexertion injury by really not changing much. The fourth thing, which seems disgustingly simple, is to simply have your head up. Keeping the head up, if you think back to the upper cross pattern in the poor seated posture, keeping the head up aligns the spine properly. If the spine is properly aligned, it gives the body a couple, helping hints. Number one, we're very visual, and our balance center comes from our eyes and inner ear. So having your head up will actually improve balance. Keeping the head up also reinforces that neutral spine posture, or wears the stick. Head up, shoulders back, hips hinged, and feet rooted to the floor essentially puts the body in neutral spine. And again, neutral spine doesn't have to be standing straight up. You can be in neutral spine in a kneeling position. So we're, again, giving the body every natural tool possible to take the mechanical load and put it where it's supposed to be, using the body as a better tool. And the fifth thing, which I've been talking about a lot, which we've pretty much shown, is neutral, aka wears the stick. One of the things that when I teach my train the trainer classes, and one of the things that you'll want to teach to your employees is always, right before they do anything exertional, to ask themselves, where is the stick? It's amazing to walk around on a job site, or while the employee is doing their job, to basically take a dowel rod or a stick or a broom handle or whatever you have around and simply put it on their back. That stick should contact base of the skull, mid-back, and your tailbone. There should be a slight space at the lower back and a slight space at the cervical spine, going back to your normal curves. It's amazing to actually hold that stick against the employee's body as they do their job throughout their various difficult tasks. I did this a while back on a beverage handler. This gentleman was a beer delivery truck driver, and he frequently had to stand on one leg, reach over a pallet in a closed space, reaching backwards, reaching over the boxes to grab a particular case of beer and pick it up and over the rest of the pallet, come down and place it onto the hand truck, which is about the worst posture you can get into. The only thing he didn't do was twist when he did it, which would have been the total worst. But simply having him root that single foot, well, first of all, I had him get his other foot down, but you get the idea. Rooting his foot, retracting his shoulder blades, and keeping his head up allowed him to pick up that object in a much safer fashion, where the load was distributed through his core and his pelvis and not just his shoulders and back. So always trying to employ or apply where that stick is makes a huge difference to the employee, because it's something they can tangibly feel on their body versus you telling them. So how do we apply these things? Well, if we look to the top pictures, obviously the gentleman with the circular saw, no eye protection either, is leaning over in very bad posture. All the load is on his shoulders and particularly on his lower back. By simply hinging the hips, retracting his shoulder blades, bringing his head up, and rooting both feet, he's able to do a normal job task, which will eventually lead to an overexertion injury if done wrong because of postural fatigue. He's able to do it safely. Exact same example in the bottom picture. Look at the picture on the bottom left, which is letter C. Horrible posture. Feet are off at funny angles. He's leaning forward. If you put a stick on his back, it wouldn't even come close. But if you look at picture D, same thing. You set the hips, head is up, shoulders are slightly back, and you could literally see that line where that stick would go to put him in neutral spine. So therefore, he's doing his job in a safer fashion. So one of the things that I like to get across to folks is what we call the SMF principle: stabilization, mobilization, and flexibility. We can employ and we can teach an employee how to root the floor, how to do a hip hinge, how to retract their shoulders, how to keep their head up, and how to constantly ask themselves, where's the stick? But occasionally, the body can't do what we're asking it to do. If you look at the picture at the bottom of the screen, it shows this depiction of somebody properly picking up a box. Now, I borrowed this off the internet. If you look at this proper lifting picture, this individual's heels are actually off the ground. So even though this person has been conceivably taught and depicted to pick up this box in a proper fashion, they're not. There's excessive load in the knee, the lower back, and the neck because they're not rooted. They have no hip drive. They have to pick this box up with their back and their knees. The second phase of the lift, same thing. Although they're slightly in neutral with the head up, hips are hinged, feet are still not at a good angle, and they're still slightly rounded. So sometimes, even being taught the right way to do it, the body can't do what we're asking it to do. Hence, we need to take it one step further. And this is where I humbly believe that a lot of programs don't go the full distance. They sort of fail because they're only training movement and behavior. They're not taking it the next step. What we want to think about here for the stabilization point are abdominal bracing and spine stiffening technique. Now, everything I talked about for just the last couple of minutes has been essentially trying to get the spine to stiffen naturally with the abdominal wall firing like it's supposed to. So one of the things that we teach, and that is very well supported in the literature, is simply bracing the abdominal wall prior to doing anything exertional. Now, what is an abdominal brace? What it is a contraction of the abdominal wall done just before the body accepts whatever load it is dealing with. And the way we teach it is pretty simple. As you're sitting at your desk listening to this webinar right now, I want you to sit up nice and tall, or preferably stand up. Make sure your feet are shoulder-width apart. Root your feet to the floor. Put your spine in neutral. Take your thumb and first finger and place them on either side of your belly button. Press into your belly just a little bit, and as you press into your belly with your hand, I want you to gently push out against your fingertips with your belly. That contraction that you're feeling is an abdominal brace. An abdominal brace will actually stiffen the spine because the muscles we're recruiting, the transverse abdominis and the internal and external obliques, actually have a common attachment point through some fascial connections into the lumbar spine, therefore stiffening the spine. Pulling the belly button into the spine does not work. That's called the abdominal hollowing or the drawing in technique. What it does is actually makes the normal curve that we want to have in the lower back go away. It flattens the back out, and therefore we no longer distribute load like we need to. So nobody should ever pull their belly button into their spine with exertional lifting. Your body primarily wants to push out anyway. All we're trying to do is trick it to do that with the 5 techniques I taught you a few minutes ago. So if your feet are rooted, your spine is in neutral, your head is up, and you are in a hip hinge, so go into a very miniature squat, your abdominal wall actually naturally turns on. After this webinar is over, I would encourage every single one of you to go to the broom closet in your office, get out a broom and put the broom on your back so you're in neutral spine. Root your feet. Make sure your head is in contact with the stick in neutral. Retract your shoulders as you're holding the broomstick on your back, one hand over the head, one hand just below your tush, and go into a miniature squat. You will be amazed at how forcibly your abdominal wall contracts. It's when we can get an employee to do that unconsciously in various lifting postures that we have succeeded in changing behavior, both ergonomically and biomechanically. Now, from a mobilization standpoint, over time, muscles that are caught in that upper cross pattern and lower cross pattern form adhesions and trigger points. Muscles can only fight for so long before they essentially give up. And when they give up, they sort of scar themselves down to create a last line of defense before rupturing or tearing completely. As you're sitting at your desk now, I want you to take your thumb and first finger, or just your thumb, reach up onto your trapezius muscle up onto the top of your neck, and dig around. You all have some trigger points there. When you touch one, it's going to hurt, it's going to be sharp, it's going to be painful. You have a lot of these trigger points in the shoulders, upper back, mid-back, chest, hips, and glutes. That picture I talked about earlier where the person was supposed to be depicting a proper lift even though they had their heels off the ground, a lot of employees are physically unable to get to the safe lifting depth that we need them to, or into a safe lifting position, because their bodies don't possess the ability to move normally because of these trigger points. The best way I could describe a trigger point is, like a bicep curl. Your bicep is designed primarily to basically feed you. It's designed to put food into your mouth. That's its job. If you were to have a major trigger point in your bicep muscle, when you want to bring your hand to your mouth, it may rotate your hand toward your shoulder, which puts an excessive amount of strain on the elbow and the shoulder joint. That's essentially what a trigger point does. In the hips and the low back and the pelvis, it has a massive cascade effect up and down the entire kinetic chain of movement. So we can actually use a tennis ball for self-massage to break up these adhesions and trigger points. If we can break up an adhesion and a trigger point so it is no longer changing how the body moves in a deleterious fashion, then suddenly that employee is able to achieve a proper lifting or proper movement depth to get the object they need to pick up, push, pull, lift, or carry in a safe fashion. This technique is phenomenal. Now, getting the employees to do it is a different story. That's where the training officer, field training officer, supervisor, safety officer comes in. I highly, highly recommend, if your employees are not mandated or allowed to or required to stretch prior to their shift, that some policy be put in place to do so. Stretching doesn't need to be complicated. These stretches right here are what I call the Big Six, and there's various different compilations of the Big Six, but essentially we're looking at stretches that can be done on duty, in uniform, prior to the shift, and preferably just after their lunch break. It can be done anywhere, anytime, any place, and none of these stretches require somebody to lay down. To take it one step further, we could also look at some pre-shift functional stretching to give the body a warm-up. Everybody knows you shouldn't do things with cold muscles, but nobody really knows how to get the muscles warm. Functional stretching is more of a movement-based stretch. Now, functional stretching, disclaimer, is only to be done by employees that have done static stretching, so back here, and done self-mobilization techniques. You don't want to take somebody through functional stretching if they don't possess the ability to move the body, at least the basic way. So some examples of functional stretching are Spider-Man's. You start in a prone position, so all the muscles in the core are working. The leg comes up, stretching essentially every muscle in the lower body, alternating sides. The nice part about these is they're held for 5 to 10 seconds. They're done a couple times, and you're done. Inchworms, phenomenal exercise where we're stretching posterior chain. Feet are rooted, you're getting a calf stretch, hamstring stretch, low back stretch, hips, glutes, shoulders. Some additional functional stretches for people that do a lot of sitting, or is a standing hip flexor and psoas stretch. This is probably one of the best stretches an employee can do. It's very simple. It's one of the main players in low back injury, which is the hip flexor and a muscle called the psoas, P-S-O-A-S, to relax a little bit so they're not putting such an anterior pull on the torso and the spine, creating the chance for low back injury. We can do some upper back and neck stretching, where we're actually stretching the nerve root and the muscles as they run all the way down the kinetic chain of the arm. Very, very, very simple to do. So to kind of wrap this up, what we're really trying to do are a couple of things. We want the employee to be taught a method, a process, so to speak, where they're going to unconsciously follow the 5 tricks, the 5 tips to injury prevention. We want to remember, they should be unconscious to the point that when they walk up to an object, no matter what it is, they're going to put their feet wide. They're going to root them to the floor. They're immediately going to drop their hips. And the nice part about this technique is once they've learned to feel the broomstick on the back, 3, 4, and 5, the shoulders back, head up, and neutral spine position actually occur automatically. So once they root their feet, drop their hips slightly, shoulders back, head up, that's going to automatically put the stick on the back so they're in neutral. They're going to grab the object, and all they're going to say to themselves, or if they're doing a partner lift, like as with an EMT or a firefighter, they're going to simply look at each other and say, ready, brace, which is going to remind them to push the belly out, bracing the abdominal wall, thereby stabilizing the spine, lift. So what I teach all my public safety folks is ready, brace, lift. It's a check system. Anytime you employ any type of biomechanical behavior modification, there always has to be a check system put into play. So first off, there's going to be that self-check. Root the floor, hip hinge, shoulders back, head up, neutral spine. But at the same time, what about the coworker? It should be a coworker's responsibility to not only coach and reinforce another employee, but to also report them if they're seen doing it wrong. Supervisors, training officers. The best thing you can do is constantly reinforce this culture of safety. And that's a very normal thing that everybody is already doing. We're very safety conscious. But at the same time, we're so worried about OSHA-type safety, which you have justifiable reason to be worried about, that we're not always taking into account the safety of our musculoskeletal system. And these are easy steps. Simply watching an employee, move a manhole cover, or someone in a healthcare facility transferring a patient. That nursing supervisor or another nurse should be easily able to stand there and say, hey, your feet are a little too closed. Why don't you, don't forget to drop your hips. Constant reinforcement, constant self-checking is the way to do it. So as a conclusion, what I try to get my folks to understand when they go through some of these training classes is when in doubt, push out. And keep it simple. If the feet are rooted and they're shoulder width apart, the employee should be able to squat normally. Even if they're in a lunging or a kneeling position, the front foot's flat and rooted. The back foot's obviously going to be on its toe, but you can still be rooted in a hip hinge with an abdominal brace in neutral spine with your head up and shoulders back, whether you're kneeling, squatting, bending, stooping, it doesn't matter. Transferring a patient, lifting a manhole cover, digging a ditch, the technique is exactly the same. It's just merely how the employee is taught in a very segmental fashion until the point that the 5 steps, the 5 tricks become completely unconscious and normal for that employee. And that is where the burden really does fall upon the safety officer, the supervisor, the employer, and ultimately the other employees to make sure that these techniques are reinforced and followed on a daily basis. All right, Sarah, I think that's all I got.
Thank you for presenting for us today, Brian. That was a great presentation. Everyone, if you think of a question for Brian, or if you'd like to take a look at his website, thefitresponder.com, or view his blog, fitresponder.wordpress.com, please take note of those addresses there. You can also see his email address is fitresponder@thefitresponder.com. Okay. Okay, Brian, we do have a question from Steve. And Steve says, how long do you think it should take to release a trigger point when using your tennis ball technique?
Great question. Normally, a trigger point is going to take a couple of, I'd say at least a half a dozen, call it sessions. Generally, trigger points are going to lessen over time. So for the employee to do something as simple as watch TV while they're doing their trigger point massage, addressing the trigger point for about 15 to 20 seconds per spot, and then moving on to the next trigger point in the chain, we've actually seen, very measurable changes in movement within 5 minutes. But keeping the trigger points at bay to the point that the scar tissue will start to release, and then when the employee is following those 5 tips for lifting, moving, pushing, pulling, or carrying, that actually makes the muscle stronger, and then the trigger points eventually don't come back. But because it is more of a scar tissue, there is permanent damage that has been done there, so the tissue needs to be addressed on a semi-regular basis after that. We usually recommend, every other to every third day when appropriate. If you're dealing with a shift worker, as in public safety, they can do it when on duty. If you're dealing with more of a regular employee that is working a 9 to 5 type of environment, Monday through Friday sort of thing, we recommend kind of doing it on a calendar basis where they're doing it every Tuesday and Thursday, or even doing it during their shift, being maybe skipping a day of stretching to do a day of tennis ball massage. But ideally, we're going to look at, you should see pretty marked changes if they're doing it appropriately within about 6 to 10 sessions, which would be about probably 4 to 5 weeks.
Thank you, Brian. Now we have a question from Janice. And first off, she says thank you. Great posture is always important. And then her question is, how do we teach employees that in addition to using good posture, we're not superhuman, and the muscles still have a point where lifting weight is too much to accomplish? Second, in your view, what is that point?
How do you teach employees to realize when too much is too much? That's a great question, because if you're dealing the difference between men and women, there's going to be society-based issues on that. The bottom line is, when in doubt, ask for help. It's always easier to do the job if you can have a second person to do some of the lifting. If the object is awkward, and again, I don't know what the particular focus your question is in as far as industry goes. If it was healthcare, I would say if the patient is obviously obese, don't attempt to move yourself. If it's more of a rescue setting, unless it's an absolute dire life or death emergency, use your gear. Always try to get it done using the adjuncts that you have at your disposal. If it's more of an industrial setting, that's where appropriate ergonomics into the workplace is huge. Bottom line is, if you think the load is too ungainly, it's too unwieldy, it's too difficult to grip, I would definitely at that point have the employee coach to ask for help or some lifting adjuncts. Now, as far as what the point is where they think it's too much, that's obviously going to be dependent on the individual. I work with a lot of public safety and industrial folks that some of these are very big, very strong men, and strength is really irrelevant in this aspect that we're talking about, because we're more worried about that chronic postural fatigue. You can be as strong as an ox and able to squat 300 or 400 pounds, but if your body is stuck in a lower cross syndrome and your glutes aren't doing what they're supposed to be doing, even a moderate load can cause tissue trauma. So, it's kind of a difficult question to answer and to quantify, because it really depends on the person's underlying biomechanical issues. Again, it goes back to, can you move this object with the 5 key points at play? And if you can't, then obviously the object weighs too much. That's probably the way I would spin it to the employee, that if you can't follow those 5 tips, rooting the floor, hip hinge, shoulders back, head up, neutral spine with the abs braced, if you can't maintain those 5 things, then it's too heavy.
Thank you. Now we have a question from Mike, and Mike says, what are your thoughts on back belts? The literature doesn't support their use, but they are sold in the concept of supporting an abdominal brace.
Yeah, that's a great question. I am not a big fan of back belts. The literature does not support them. You are correct. The problem with, and it was conceived early on that if you push the natural thing your body wants to do is brace the abdominal wall. And if you brace out against a belt and that belt wraps around the lower back, it would conceivably cause some overpressure and additional stiffening. However, that has not held true. Got to remember, the abdominal brace is one facet of safe lifting. If the glutes are not doing what they're supposed to be doing, then it doesn't matter how strong your abs are. You're still going to have an unstable attachment point for your spine because your pelvis is still going to be out of place. So you have to look at hip flexor stretching, gluteal strength, proper gluteal flexibility, as well as abdominal bracing. And the bottom line is, your body is the ultimate tool. And to make it the ultimate tool, it shouldn't have to have these adjuncts to do its job. It should be able to do them naturally in that segmented fashion. Hope that answers your question.
Thank you, Brian. Now we have a question. Oh, Mike actually just wrote in and said thank you. That did answer his question. And we do have one question remaining. This one's from Andrew. And he says, Brian, I understand about pushing out with your abdominal muscles, but how about squeezing with your gluteal muscles?
Another good question. You only really want to squeeze with the glutes if you're in a static posture. The glutes should be able to fire independently and turn on and off throughout a movement because they're going to help the pelvis articulate, or the hip joint and the pelvis articulate. So if you're squeezing the glutes while doing movements, you can cause some issues. Now, if you want to take it into the physical therapy realm for a minute, there are a lot of techniques where if I'm rehabilitating somebody with a bad lower back, I will teach them to squeeze the glutes and then do, say, a bridging movement, or the hip hinge that I showed that picture earlier in the squatting position. One of the things we'll do as a teaching tool is to teach the patient to visualize grabbing a heavy gold coin at the bottom of the squat, pinch that gold coin, hold it between their cheeks, and come up to the top of the squat position, and then let the gold coin fall back down to the floor. It is nothing more than a teaching tool because in the real world, you don't want to necessarily have your glutes tight the entire time. If you're on unstable ground and one leg is higher than the other, or you are in a kneeling or a lunging position, you can't do that. You can't squeeze your glutes that way. That's only generally going to work in a normal posture. So it's a wonderful teaching tool. It's great for somebody that is stabilizing a load because it does kind of lock things in place. But concurrent to that, it is difficult to squeeze your glutes and maintain a hip hinge. So it really is dependent on the situation. If you're, like I said, if you're standing statically, stabilizing a load, I think a gluteal squeeze is wonderful. If you are picking something up at depth or putting it back down, you need to be able to have the hips hinged, and again, that's very difficult to do with the glutes squeezed. I hope that answers your question.
Great. Thank you, Brian. Thanks again for presenting for us today.